Dear organizers and colleagues from around the world, with the Sustainable Development Goals, countries committed to ensuring that all children have a chance not only to survive, but to thrive and reach their full potential. It is their right to receive all support needed from responsive parents or caregivers, as well as health, nutrition, education, and related sectors and systems. In UNICEF, we recognize specifically the first 1,000 days between conception and a child's second birthday as the most important window of opportunity to protect and establish a healthy future and potential to thrive for a child's life. Yet, in many countries, there are numerous lost opportunities to address child survival, growth, and development because existing systems for primary healthcare and other social systems and services are weak with limited resources. Home-based records have a role to play in the support for health and well-being of women and children. They have been recommended by the WHO to improve care-seeking behavior, men's involvement and support in the household, maternal and child home care practices, infant and child feeding, and communication between health providers and women and caregivers. They are a tool useful to mothers and caregivers as well as service providers. They can help to ensure that information across different sectors and services is provided, recorded, and they can create a link to civil registration and vital statistics. Yet many countries, as you know, are facing complex implementation challenges for home-based records, including frequent stockouts, challenges in making them universally accessible, or ensuring their content is used to its full extent by all users. Information might not be recorded or is incomplete, or information available is not used and does not lead to action. Take an example. Health workers plot the weight and growth of a child, which suddenly falls off its trajectory. This information can point to a potential underlying acute or chronic health condition and should lead to further evaluation. For home-based records to have an impact on maternal, newborn, and child health and nutrition outcomes, it requires an ongoing effort and coordination across multiple health programs and ministerial departments and links to other health data and communication activities to ensure they are available, used correctly, and are valued by all users, that is women, parents or caregivers, health workers, and program managers within the health system. Over the past 2 years, UNICEF, the WHO, and JICA have closely collaborated with partners globally in regions and countries. Some of you are participating in this meeting to advance the implementation of home-based records. In the fall, we will be launching an implementation guide for home-based records. The guide is designed for program managers within ministries of health, as well as policymakers and other stakeholders involved in making decisions and taking actions to strengthen the implementation and use of home-based records. It aims to support their efforts through improved processes for planning, content, design, implementation, and monitoring. The guide considers 8 factors for success that help to ensure home-based records achieves the intended impact. These factors are high-level support by government and key stakeholders, an established cross-sectoral coordination mechanism to take decisions and oversee implementation, carefully selected content of home-based records that supports national health priorities and objectives, well-planned and costed printing, distribution, and resupply, accurately estimated budgets and sustainable funding, and to ensure that the use of home-based records is valued by all users, health workers, as well as women, parents, caregivers, and community members. And last, monitoring processes are in place to ensure objectives and users' needs are met and operational support processes are optimized. You will be discussing many of these factors and their contribution to the success of home-based records today in your meeting. We look forward to sharing this guide soon and work with all of you, especially our colleagues in countries, to advance and learn together on how optimizing the use of home-based records ensures that all children have a chance to reach their full potential. I wish you very fruitful discussions during your meetings, and thank you very much. Bye-bye.